APHA, and we're doing an interview with Dr. Mark Sherstinsky from our clinic at SUNY, and we're also with our friends at optometrystudents.com.
Just an introduction on Dr. Sherstinsky. He's currently a supervisor in the GP clinic and also a faculty member here at SUNY. He teaches the epidemiology class during the summer of the third year. He graduated from the University of Berkeley, College of Optometry 2001, and he did his residency in 2002 and received his master's in public health at NYU in 2010. First of all, thank you.
Thank you.
And we found these photos quite easily on Google. What do you think of them? Apparently you were known as El Fuego Muertes to these creatures.
This is a photo of massacred dolphins and a dead bear.
I was impressed.
With my headshot superimposed on it. Really poor Photoshop job. Whoever did that. Not you, no.
One moment, please.
Okay.
You say there's no history.
This is a cartoon of Mufasa with my head photoshopped over it. Yeah.
Alright, so this interview is going nowhere I thought in the beginning. So let's continue with the public health.
Okay.
Okay, so Dr. Sherstinsky, when did you first decide to get your MPH?
I decided about 7 to 8 years into my optometry degree. I had entertained the thought for probably a few years before that, and then seriously considered it for a couple more years, and then finally took the plunge. I wasn't always interested in public health, but I was working at a public health clinic in East New York, in Brooklyn, which is a socioeconomically disadvantaged neighborhood. It's one of the historically poorest and most violent neighborhoods in New York. And it was in a public health clinic that I kind of started seeing patients in a different light.
Yeah. So what do you mean you saw your patients in a different light? How would you like to elaborate on that?
Yeah, well, you know, in the exam room you have to dim the lights, and so it was a different light. No, seriously, when I first started at this clinic, I maybe, for example, saw 1 or 2 patients with diabetes, maybe a week. After a few years working there, I noticed that the number of patients with diabetes was increasing. The number of people with obesity, high blood pressure, diabetic retinopathy, they were just kind of becoming a mainstay of my day. And I felt like I was, managing and monitoring and patching up people only to send them out into the same environment they were coming from. So I became interested in understanding what that environment was.
And how have you brought that into the clinical setting here at SUNY? How would you feel it's benefited you here at SUNY?
Personally, it's given me a little more opportunity in terms of teaching. For example, I teach the epidemiology course to the third year class. It's allowed me to be able to research conditions and findings and risk factors a little bit smarter than I would have in the past. I have a little bit more understanding when I'm in the exam room about what a patient's risk factors are, depending on what their socioeconomic status, ethnicity, conditions are.
In your experience, what is the best way to get public health information to your patients and to their communities?
Certainly. When we see patients with diabetic retinopathy, we dilate their eyes, of course. We take a look at the retina, and then we tell them you have no diabetic retinopathy, or you do have a level of diabetic retinopathy. There is a host of other things that we can talk to them about. It may or may not do good, but I think that at some point a patient may take their diabetic status seriously if they have their eye doctor tell them look, I'm looking at the vessels in the back of your eye, and I can see that they're compromised, they're bleeding, and they're going to bleed into your macula, or you'll have other complications that'll cause permanent vision loss. You know, when their eye doctor can talk to them about their A1C, about how medications only go so far. It's really diet and exercise that make the medications work well. I think that, you know, that extra bit of conversation with the patient makes a difference.
You said a healthy lifestyle. Some people say it's very expensive to have a healthy lifestyle, especially in this economy. I was wondering for example, what would you do to maintain a healthy lifestyle on a budget? Mind you, I haven't eaten for 5 days in order to pay for the razor to make this uneasy mustache.
I see. I was wondering,
I apologize.
yeah, bite your mustache, yeah.
Is there something that you notice when you're supervising students in clinic that maybe you see more of a need for students to be aware of public health issues while we're doing our exams? Is there anything that you notice?
Good question. I notice a lot of things. I'll give you an example. A patient comes in, gets diagnosed with glaucoma, and the student and or doctor happily writes them a prescription for Travatan or Lumigan. It's a very expensive drug. Without ever really investigating the patient's ability to afford that medication, they write the prescription, and then the patient may be in a quandary as to whether to spend $80 to $100 on a medication that can potentially prevent them from going blind, or whether there's another option out there for them. So that's in a sense a public health mindedness about the doctor or the student treating the patient with what conditions they're going to send them out into.
Right. And then it's not just solving the problem in clinic, and we have to think about more long-term solutions for the patient.
That's exactly right.
With all the experiences from here that you've brought to SUNY, how are you able to incorporate public health in a global sense and to do things abroad?
One of the reasons I went to get an MPH, and I got my MPH in a particularly international focused program, the NYU Masters of Global Public Health, it's called, was I was interested in working abroad. And in the last 10 to 15 years, health has really become globalized in the sense that there's a lot of collaboration between people in different countries on health. So an optometrist these days, for example, can diagnose or look at or manage a condition halfway across the globe using telemedicine, or they can go to a different country to treat and work or develop programs with other optometrists or other eye care providers. So I originally did my first externship as a fourth year in Beijing, China, and that really opened my eyes to how different the practice of eye care is in another setting. And I was lucky to be able to compare that to how we do things here. It allowed me to be a little bit more flexible and in my own management of patients. The old model is kind of like the Vosh model, where you go to a site for a week or for a few days and you treat a few hundred people, and then you leave. And that's really been the old mission model of public health. Now, really without putting in a sustainability item on the program, a lot of places won't actually commit themselves to implementing a public health program. So sustainability is really the key. Vision 2020, which is the World Health Organization in the International Agency to Prevent Blindness program to eliminate avoidable blindness by the year 2020. All the programs are meant to be sustainable. So they're implementing permanent programs in various countries, so that the reasons for those blindness don't come back.
What financial benefit do you feel public health gives to just someone worrying, oh, I'm just trying to stay afloat in this economy, how can public health help me directly? What example could you give someone to give them the benefit that knowing public health and being aware of all the information and all the programs out there, it can help you directly as you help other people?
It's a good question, and that was the question that I asked myself. Was it worth for me to do this? And
just to reiterate, we found this picture on Google also, and this is Dr. Sherstinsky in I believe it was an MTV Cribs, and just to remind you people that is.
Yeah, that's actually a real picture of me that was not photoshopped. That is my home.
Congratulations.
One of them very nice.
Ramen noodles are disgusting. So it's nice. It's nice that you live so well.
Yeah, I think you should go into public health for the money. It would be for mainly for those two things, personal and professional fulfillment. Certainly, if you work in an academic setting like SUNY, there is opportunity to grow, and I've certainly been able to grow within the institution. If I ever decide to go anywhere else abroad, I have some experience in public health, that I could join one of the zillion NGOs or government institutions to do other, maybe even non-eye care related public health work.
Good. Where would you, for a student, where would you get your sources of information involving public health? Like if someone was watching this video, what could you recommend for them to begin getting their information about public health?
Information regarding public health. Well, in the eye world, I would visit the Vision 2020 website, the WHO IAPB website, just as an example of global public health. Public health journals, you can kind of get an idea of what people are doing research on. So the American Public Health Association has a journal that they publish research all the time on everything from socioeconomic status in inner cities in Detroit to fistula in Africa. So you can look that up. Look that up.
Thank you for being here. Thank you very much for the interview.
Thank you for having me.
No problem. Just one last question before we wrap everything up. Being an optometrist is a full-time job. I was just wondering how you juggle being an optometrist while having a full-time fighting the Batman, as the Riddler. Just, he's Bruce Wayne, right? Just to ease things up. It just makes sense.
Yeah. I probably shouldn't tell you that. Well, I can tell you that, but then I have to kill you. And I have a lab right now, so there's no time for that.
Well, thank you
That
for
concludes-
making
Yeah,
time.
thank you.
Thank you very much.
Yeah.
Thank you. No
Yeah.
one should like whatever this is on my face.
Yeah. Mustache.
right.
How many friends do you have with a mustache?
She just lost one.